Hello, I'm a naturopathic doctor. My name is Dr. Maria Shapoval, and today I'd like to talk to you about my work as a naturopathic doctor and briefly talk about some of the services that I provide to my patients. So I've been in clinical practice for the last 10 years, and during that time I've been focusing on working with patients with neurological conditions, including Parkinson's disease, Alzheimer's, multiple sclerosis, epilepsy, migraines, peripheral neuropathy, and others. So as a naturopathic doctor, there are many different tools, many different services that I've had the privilege to offer my patients. And some of these include things like acupuncture, mindfulness guidance, dietary recommendations, that's quite a big one, as well as herbal medicine, nutraceuticals such as supplements, homeopathy, hydrotherapy, and many others. So as you're listening to this, if you're not familiar with naturopathic doctors in naturopathic medicine, one of the areas that I find that we differ quite a bit is in our holistic approach. So because we have more opportunity to spend time more time with our patients, that gives me the opportunity to hear more about how a particular condition affects the entire person. So because I focus on neurological conditions, from this perspective, it's not just about how does your brain function and how does that affect your daily living, but how does that affect your heart? How does that affect your digestive tract? How does that interact with the other organ systems? And ultimately, how does this impact your day-to-day living? So because there's opportunity to spend more time, that also means that there's opportunity to learn more about how the whole organism functions and how it doesn't function, and where these particular treatment approaches could be most effective. Whether it makes sense to first heal the digestive tract before focusing on helping to nourish the brain, nourish the nervous system, so that the digestive tract can actually do its job properly and absorb all those nutrients? Or is it a better approach to actually focus on the sleep? Because as you can imagine, sleep is a very important component of our day where much of the healing takes place. Much of the memory, consolidation, and growth. And so maybe this is the approach that actually makes sense to spend a lot more effort on, whether to target that with acupuncture or herbal medicine or mindfulness, or dig even deeper and try to understand why the sleep is a problem to begin with. The other component of our medicine, so one was luxury of time, two, maybe an opportunity to have a more holistic approach, to look at the entire person and the entirety of symptoms that you present with. And the third component is not as much of a difference, it's more the perspective. So I see naturopathic medicine as another form of medicine that works very well in collaboration with conventional medicine. I will often write summary notes and introductory letters to the medical doctors of my patients, whether that's family doctors or neurologists or cardiologists or whatnot, so that we can all be on the same page and know exactly what goes on in the naturopathic visits, so that everybody has a very clear understanding of where the risks are, what the benefits are as well, and so that we can have direct line of communication. And the other stream maybe of services or opportunities is that in Ontario, where I'm currently practicing, we do have the scope to order laboratory medicines, so various blood tests. While unfortunately they are out of pocket, so that means that's a patient expense, there is this option as well to order tests that may not be typically run under the OHIP system, but these tests, some of the tests may still be quite valuable to offer a different perspective on what's going on with the body. So I hope that I've given you a little bit of information about what naturopathic medicine does in general, and also what I do in my clinical practice. Hope to hear from you. Please don't hesitate if you have any questions, and I look forward to working with you at some point in some way. Take care.